I can do a letter for you that says about the fact you've got epilepsy and about your other conditions as well. And then you talked about your mood. Tell me more about your mood.
I've been feeling really depressed lately because of a lot of personal issues. Everything that pretty much could possibly go wrong in my life has. I've been feeling kind of like suicidal at points as well. And yeah, and just sort of like come home and like cry every night pretty much, and not feeling sociable at all. Don't really like go out, and yeah, I just feel like really down.
And then what specifically happened? So you said that there's been some things happening, but what's happened?
My granddad died, and
I'm sorry to hear that.
my brother was stabbed. My mum and my stepdad are getting divorced, and plus my boyfriend also is in prison as well, so that's quite stressful. And just sort of, I feel like I'm under a constant battle with like my sort of conditions and stuff. And like I just feel so worried.
You talked about feeling suicidal. What is it you thought about doing?
Just like, because I just don't see the point of going on, because I just don't have no one there for me at all, just to comfort me even. Not even, because I'm not really much of a talker anyway, just to like have that bit of comfort, you know, just to have a hug and say everything's going to be all right kind of thing. And so just like ending it really.
What is it you thought of doing to do that?
Just like slitting my wrists and just like chucking myself under a train.
How's your sleep?
Not good. I've never been a good sleeper anyway, but there's not really a lot I can do about it because of the medication that I take for my epilepsy.
And you talked about feeling suicidal. Would you ever act on these thoughts? Would you ever act on those thoughts?
No, because I'm not a selfish person, and I know that I'd cause a lot of hurt to a lot of people if I'd done that.
Because it's important, if you are feeling suicidal, that you need to let us know or someone else know, because we don't want to see any harm coming to you.
Yeah.
Yeah?
No, I wouldn't do that because I'm not a selfish person like that. I wouldn't do that to them.
Have you suffered with depression in the past?
Yeah, but like not on, like, you know, bad things have like gone on, but you know, it's just not onto the degree that I feel at the moment.
We can refer you for counselling here if you want.
I've never been a great fan of counselling because I'm quite a private person. Like I said, I'm not really much of a talker. I can take everyone else's problems on board. Like, I'm a great listener, and I could just sit there for hours for someone talking to me and listening. But I don't really like the idea of just talking to some random person.
And have you thought about anything like antidepressants or medications? Is that something that you've thought about?
Yeah.
So one of the theories behind when people get low in their mood or depressed is that one of the chemicals in the brain is low. So antidepressants help to boost up that chemical. Quite often, you have to take them for at least a month before you might see any benefits of taking the antidepressant. You can get side effects. Common side effects with antidepressants tend to be nausea, vomiting, stomach upset. Some of them can cause problems with vision as well.
Okay.
Antidepressants, I wouldn't say that they're a long-term solution. I think they can be good to help get people out of a rut as such, you know, in combination with other things as well, because you've got to look at different life aspects, and if there's something that's making someone feel depressed, to deal with that as well.
I guess it's something I can try.
Yeah, are you wanting to try one?
Yeah.
Yeah.
Quite a big proportion of our patients that will come in with, you know, either depression or feeling low in their mood or anxious or in a distressed state as well. On a daily basis, I might see maybe 5 or 6 patients that are going through some sort of form of distress.
Because of the other medications you're on, I just have to double check about what we can give you.
Okay.
I'll get back to you at lunchtime today.
Okay.
All right then.
Okay, thanks very much.
All right, good to see you again.
I can help you today, Dwayne.
My mum passed away last year, February. I hadn't really grieved. I ain't seen counselling or bereavement classes. I just haven't got time, to be honest, and that's me being honest. And I've got to be strong for my kids. I come up with some little rash just before Christmas, and I'm trying to keep my stress levels down, but my armpits are sore where it's flaring up there now. Crease in my arms, it's sore. My neck is sore, my face is sore, and that is stressing me out because my eyelids are getting itchy and sore. But my face has taken a piss. That I'm going to get stressed because it's really tender now.
Yeah. Okay. Do you want to pop your jacket off and let's start by having a look at your arms?
I've never suffered allergies. I don't know what's caused it. I don't think I've dealt with stress since I was 8. My mum's had asthma, diabetes, high blood pressure, blood clots, arthritis, and rheumatism. I've dealt with stress. I've never had nothing like this. It's already sore, especially this part of my belly.
Yeah.
It's like it's inflamed, and I don't know what it is. My friends keep telling me it's not psoriasis, but I don't know. I've never had skin allergies.
Yeah, so there's different types of psoriasis that you can get, and where you get the big flaky bits, that's called chronic plaque psoriasis. This looks like a slightly different version of psoriasis.
Is this common?
No. I mean, by far the more common version is the chronic plaque psoriasis. This is different, yeah, and
Will this go away, or am I stuck like this for life?
No. We will get rid of this for you. Don't worry. It's gonna be better than it is. This is not satisfactory for me or you. I mean, psoriasis, if we're treating it correctly, it improves, but it doesn't improve like in a week. It takes like 4 or 5 weeks of sustained treatment, which
That's
is
what I heard. It would
things to
take
improve.
5 weeks. That's what the hospital told me. 5 to 6 weeks.
The one thing that I would add in, which you haven't had yet, is a steroid. And I think that would really help with the soreness and the redness.
Okay.
As hopefully the sun comes out a bit more, and we will encourage you to get out in the sunlight a bit more as well, because sunlight helps to improve this as well.
What about sunbed? I've never used it before, but I'd jump on out of that to get rid of it. Well, I'm serious. No, I don't need to use it, but I'd jump on it if it gets rid of this.
Yeah, it probably would.
Probably would.
It would probably help, yeah. That's not to say go mad on sunbeds.
No, I wouldn't go mad. I don't need to go mad. I've got an all-year-round tan. It never peels, never fades. But this is annoying me because I don't suffer from no allergies.
We will see what happens over the next couple of weeks. Like I said, if you feel it's getting worse, just come back and we'll get you seen by the skin specialists.
Okay, then.
Great, and yeah, I mean, ultimately coming back to, the stress that triggered it all off. I mean, is the loss of your mum, is that something that you think you would like help with at some point? Or?
To be honest, I do security. I do between 60, maybe 80 hours a week. I physically ain't got time.
You haven't got time.
Yeah.
Life's in the way.
But I'm all right. And I know my mum would want me to be strong.
Come on in, Brian. I'm very well, thank you. What can I do to help you today, then?
Right, I'm starting to be a bit irate, right? I've had a confrontation on Thursday. I filled him in, right? I punched him in the face, and that's made me scared because I'm not dangerous like that, right? As you know, and you got it on your record.
Who was it who you hit?
My friend, who's a security guard, I'm trying to calm down.
Yeah.
Because it's all my nervous system, from my fingers here to my toes, and especially my head. It's like it's on fire inside and all that, you know what I mean?
So let me just check that I've understood this right, Brian.
Yeah.
So at the moment you're finding that you're feeling a lot more tense and,
Yes.
and angry at the moment at the world.
That's right.
And you have this tendency to lash out at people when you're feeling that way.
It's mainly frustration, that's
Yes.
right. That's what is causing it mainly.
Okay. Do you
Because
think that mentally you're not coping as well at the moment for some reason? Because ordinarily it's not in your nature to get this angry and hurt people.
No.
So is something making it a bit harder for you to
Yeah.
tolerate people at the
yeah,
moment?
that's right, because...
And what do you think that is?
It's because Cameron and what he's doing, really, and all these idiots he's got around him, it's really annoying me. And my mobile phone company, they know I'm blind and all that. They keep sending me text messages, and I can't read them.
Not particularly useful, no.
So I find that's taking the piss out of my disability, and that's it. That's upsetting.
Yeah.
And he doesn't want to grab them and kill them.
So how are you going to bring yourself down to help you calm down a bit and relax a little bit more?
Well, that's why I've come to see you, really.
Yes.
We need something to sedate me, or, not to put me out like that,
Yes.
But something milder, if you like,
I was just looking at your medications in the past.
Yeah.
And back in 2011, you took olanzapine for a period of time. And that's a tablet we sometimes use to calm people down.
Maybe a tablet like that would help, would it?
I wonder. I'm not sure I want to use that now.
With regards to mental health, obviously there are medications which we can use, but I think they are not always the best and first thing that should be turned to. And there are other things that can be done, such as counselling, other therapies, good lifestyle choices like eating well, exercise. These are all things that can have a really positive impact on mental health.
It's frightening, really, in one sense. I don't want to be a nuisance to you and the public. I don't want no convictions or no violence at all in my life. I don't want to shoot someone, like my doctor or anybody.
Well, yes. How are you sleeping at the moment?
Sleeping. I normally go to bed about 3 o'clock. So I'm getting about a couple of 3 hours at night, and that's about it, really.
What's keeping you up till 3 in the morning?
Well, all I'm doing is watching the telly.
Telly's rubbish after midnight, though.
The TV and all that is a voice, So I feel comfort from it.
Would you say you feel lonely?
No.
No?
No, I'm not lonely, no.
No?
I like my own space.
Okay.
And I like to be on my own.
So you're happy in that respect?
Oh, in that respect, I'm really happy and all that.
In 2010, when you were feeling quite low, you were hurting yourself. How did you harm yourself back in 2010? Do you remember?
I get my knife from the kitchen.
Yeah.
And cutting.
You were cutting your arm.
Cutting my wrist.
Right.
And all that up here.
But you're not thinking about doing it.
And your knees.
But you're not thinking.
And your knees.
Right.
And stabbing the knife in your leg.
Right.
And saying, here, feel that, you twat, feel this, and all this, which is dangerous and self-harm.
Yeah.
Right, which you shouldn't be doing.
Are you doing anything like that at the moment to yourself? You're not harming yourself?
No, I'm not cutting my arms or putting marks on me.
Do you think it would be worthwhile speaking to someone about how you're feeling at the moment and about these feelings of frustration and anger you're feeling?
Yes, I think that'd be great.
Okay. I can arrange that. I can do that by referring you somewhere called Southbrook Road. They're the Community Mental Health Trust.
Oh, you don't have to be a mental to go there.
God, no. The vast majority of the people who go there actually enjoy pretty good mental health. It's just sometimes some people need a little bit of help.
Yeah.
Nothing wrong with that.
Okay.
Okay.
Well done, mate. It's all good,
Indeed. All right, let's help you gather your things up. Right, Brian.
Thank you very much.
All the best. You're going to be okay finding your way out?
Yeah.
Good. Take care.
Thank you very much.
Bye-bye.
How are you?
Not good, doctor. I keep feeling terribly sick, nauseous, and then I get a cold sweat, and then I get a terrible pain across the top of my eye here, just on the one side. The pain don't go away. I've tried every tablet, and it's even to touch it, it's sensitive.
Okay. So when did this start?
I've had it for a couple of weeks now. It's continuously coming and going.
And how would you describe the pain?
It's like a toothache in my head. If you touch it even there, it's so sensitive.
Yes. So it's the pain that you can make worse by touching it.
Just by touching it.
Right. May I check your blood pressure, please?
Yes. Do you know what it is, doctor?
Well, I think it's a migraine.
Oh, sugar. I've never had them before.
Is there anything else going on in your life that you...
I'm just down all the time, constantly. And I'm going today to would you call the people the psychologists?
Yes.
This
Are
is
you
not-
worrying about that?
It seems strange, do you know? I don't know.
What's your biggest fear?
I just feel that it makes me inadequate if I'm attending something like that, do you know what I mean? I feel a bit worthless and a bit silly.
Okay, we could look at it a different way round though, couldn't we? Think about your body a bit like a car that has to be serviced, it's got to be looked after, it's going to go wrong from time to time.
Yeah, true.
So you take it to the garage.
Yeah,
And the garage has a look, has to do some tests. And then they'll come and tell you, they say, well, look, actually, there's nothing really seriously wrong, it's just a little bit of a loose this, that or the other. Or they might say, unfortunately, there's lots wrong and you're going to need to buy a new engine or whatever.
Yeah.
It's hard to imagine the rest of the body behaving normally if up here is in a turmoil.
Yeah, I feel low and down sometimes, and I think...
Yes.
Well...
And I think that that's one of the reasons we thought you might want to try an antidepressant.
Yeah.
Stress and depression are the bread and butter of our work. Very common indeed. And stress can be very important in many different illnesses. If I'm looking at a condition that somebody has, I might say, yes, this is the physical condition that they have, but what about the psychological element that could be making it worse?
You know, this headache, this migraine, if you like, it's the way your body is showing that it's under stress. But what we've got to try and address is what's causing it in the first
underlying
place.
thing, yeah. It's just been everything.
Just keep talking to yourself and say, look, I haven't got anything to worry about at the moment because we don't know the facts.
Yeah.
So put that bit of anxiety in an envelope
Seal it up.
and seal it up, OK? And concentrate on what is working well. I can do this, I can do that.
I mean, I feel quite fit, do you know what I
Yes,
mean? And I
yes.
think, well, I'm going to be 69 this year and I still feel quite good, do you know what I
Absolutely.
mean?
Keep
and I
on
think
with that.
Whatever I'm doing quite right.
And try to just sort of enjoy what you're doing.
Yeah.
Try to wallow in the good things in life.
I've got to try and fill every day with something that's going to be beneficial to me, even just going for a walk.
You've got to do things that are going to make you happy and that you enjoy.
Yeah. Not a bar of chocolate.
Yes, what a good idea.
Yeah.
Now, can you keep still and let me do your blood pressure, do you think? Oh, yes, I mean, this is definitely stress, isn't it? Right. These little tablets you take for the sick feeling, right?
Yeah.
And I'm proposing we give you the slightly stronger cocodamol to take, right? I hope you feel a bit better sooner, and I hope it's helped to have a little chat about things.
Thank you, Jan. I'll make an appointment next week to see if these have helped me as well.
Yes.
Thank you very much.
OK, bye.
Bye-bye.
How are you today, sir? You're feeling particularly low at the moment.
How have you been in yourself?
I'm trying to cope, but still, because it's still the same.
Is it hard?
Sometimes.
Yeah.
Yeah, sometimes.
What's happened recently to make this the worst day of your life? OK. Well, look, I'm booking you in for an appointment at 3:40. You're not a hypochondriac. Take care. Bye-bye.
Sorry to keep you waiting such a long time. Please come and take a seat. So it's been I think I last saw you in December.
Yeah.
When you just got out of jail.
Yeah.
And how have things been going for you over the last few months?
Oh, last month's been more down and up, getting low again, getting very depressed. I don't know.
All right. Sorry to hear that.
You get to a point you don't want to do nothing, like, you know what I mean? If I'm talking to someone, and it's the first thing that would come into my head is how can I get out of the conversation without talking to them? And sometimes when I talk, I have panic attacks and that, like, you know, I just burst out sweating and things, like.
Well, last time I spoke to you, we spoke quite a bit about your mood, and you were quite optimistic that things were going to be all right, having got out of jail. Have you been slipping into any of the other sort of bad habits?
No, I haven't been using drugs and anything. Just stable on my methadone and that. But because I've used drugs a lot in the past, you know, when I speak to doctors, I think they think I'm lying sometimes. Does that make any sense to you?
Lying about what?
About the way I feel and that. I don't know. It's just the way I am.
Do you mean specifically about people might think you're not depressed?
Yeah, that's what I mean more than anything. Yeah, but
it's not our job to cast judgment or really make those kind of assertions. I have to take what all my patients, regardless of their background, what they tell me, I take at face value.
No, I understand that.
You do have a mental health problem.
Yeah.
Lifestyle change is not easy for a patient to do, and nowadays a lot of people just want a tablet, they want medication, they want sort of recovery to be something passive, but unfortunately it's just not an option. So I think it's really important to give patients time, find out what they understand about the situation, and make sure there's some kind of plan for them to come back and talk to you about it.
When I last spoke to you, you didn't think that you would ever do anything. I mean, we spoke about suicide and quite some dark things as well.
Yeah.
Are those thoughts that is still not the sort of thing you'd act on, or?
No, I'm not brave enough to do it, if that makes any sense to you.
Are there any other protective factors that you think, other things that stop you? Does your mum or your son come into your thoughts at all?
Only family, really, now, yeah.
Mm-hmm.
Do you know what I mean?
I'm glad you don't have the courage to do anything.
Yeah.
But if that ever changes, if you suddenly start thinking you're so low that you think you are going to act on those thoughts, it's vital you come and talk to us. Okay? And if you can't get in touch with us, you need to pick up the phone and talk to Mind. They've got a good helpline, or the Samaritans have got a helpline. If that's not working, you have to go to A&E because they've got trained psych liaison nurses who are there for that sort of discussion.
I know that, yeah.
And I started you on some tablets as well. Do you take them every day?
I do, yeah.
Okay.
But I haven't taken them for the last 4 or 5 days because I ran out.
It is really important with these kinds of medication that you build up slowly and you don't suddenly stop.
Yeah.
Well, a big part of it is being a bit organised about your medication. Because sometimes when you're feeling low, you lose the motivation to stay organised. But actually, when you're feeling low, you need to be more on it.
Yeah.
When do I run out of tablets?
Yeah.
When do I see the GP next?
Yeah.
So I'll give you some more of your medication. To be honest with you, you've only been out of jail for a couple of months, and from my point of view, whenever I see you, I think you're doing pretty well for yourself. And staying out of the drugs and the alcohol, which got you in that situation in the first place, is the main priority.
All right, thank you very much, Doctor.
Take care.
Okay, have a nice day. Thank you.
Bye-bye.
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I don't know, my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of coming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, yeah. I suppose, yeah.
And any thoughts of cutting back on your alcohol or getting a bit more help with it? Or does your outreach worker help you with that?
Yeah, well, it is from a drug and alcohol organisation, yeah, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, you can do it. Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him actually.
Okay, no problem.
I can speak to him actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh yeah, okay.
Yeah, I'm here now. Right. Okay. There you go.
Hi, is that Charlie? Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah. Cheers, Charlie. Bye. Bye.
Bye.
Is it all right if I talk to Charlie about it?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right? And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes? So the worst they'd ever be. So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia
Yeah.
or anything. And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. But it's an unusual presentation. And
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 for it. Oh, God, I've got years in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination test. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Can you close a bit? Will you do it? Will you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good.
Oh.
Good. I want you to try and do that as quickly as you can. Quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great, thank you.
Far slower than I used to write.
Really? Yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is being such a capable lady to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
you would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
It makes it a more enjoyable job.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff, but I think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So, how are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. But yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I don't know how long it was for, but I wasn't taking any for that period.
Was that, did you just run out or did you choose to stop?
I ran out and I couldn't afford it again.
Okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into like anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that you had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. Only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's really difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay. What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? Or, and any thoughts of trying to do more than that?
Thoughts, but I don't think I'd act on them.
So in terms of today, was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Fine, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing them tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Come in. Hi there, hi, have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because I'm from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. Would you just explain a little bit more about what the prescription is for? And
it's my ADD, as well as I've been having difficulty concentrating. I'm going for a master's right now, and I guess I've been doing without them, and it's not good.
Right, okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines. But I think in America, it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription. Do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or...?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
done. It helps, does it?
It does.
You sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like, I'm just, I don't know. I guess, like, if I did get, like, a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves. Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. Like, I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr. Ducci.
Yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself. I think you're very self-aware and you're obviously resourceful, built self-reliance, but just let people in as well. I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much.
Thank you.
Bye, Tony. I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
I'm Dr. Mackenzie. We spoke on the phone last week.
Yes, we did.
Same problem?
I have restarted my antidepressants after a 6, 7, 8 odd week break.
What is it you take?
This is it here, if that means anything to you.
Yeah, and what dose do you take? One of these a day?
No, I'm taking 2 of those a day.
Right, okay. Does it work?
There's highs and lows. To cut a long story short, now I'm going to start. So, I need to get onto something that's going to give me my life back, because I'm not, it's not happening. I'm not enjoying, I'm not living, I'm not anything.
When did it all start not to be right?
Many years ago. Many years ago.
5, 10, 15, 20?
Triggered with children.
Yeah.
Triggered with the birth of the children.
So there was some postnatal depression?
Postnatal, definitely. I was obviously prone to it. It's depression in my family. We're clinically depressed. Like, you know, this isn't just low times. We're talking, yeah, pretty bad. Yeah.
Dramatic things?
I think so.
Suicide attempts?
Not attempts, thoughts.
Thoughts, okay, fine.
Which is a step up.
So psychiatrists you've seen?
Yeah. I've just got this deep-seated depression. I just don't know how to get out of it. I really don't.
Mm-hmm.
And, you know, the kids are suffering with my moods, my this, my anger, my aggression, my everything. So it's not a very nice spot to be in.
Okay, so I think
Very difficult.
the situation at the moment is certainly not to rock the boat. I think we certainly don't want you to run out of your medicines. You've had 6 weeks off.
Yeah.
And that doesn't seem to have helped. You know, so we'll give you a prescription for another month of that, and then we need to talk again. So there's enough there for 4 weeks, 2 a day, so that's the 40 milligram. So if we could meet in about 4 weeks' time. The children, boys or girls?
One of each.
Right. I want to see you before those tablets run out, so about 3 to 4 weeks up the road.
Yep.
And you can come back sooner if things were different or worse.
Okay.
Okay. Bye for now.
Bye.
Hi, all right. Come in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Lamictal.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5 years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink. I used to get very aggressive for no reason before,
Yeah.
Sometimes if I would feel a bit depressed, I would go and start punching up a wall, and then my knuckles would be all smashed for a couple of weeks. And so instead of cutting my wrists, I would do that rather,
But we're not,
Yeah, but that's...
Things are a lot better, aren't they?
That doesn't even happen,
Okay.
So.
At the moment, are you feeling suicidal or like hurting yourself?
No.
No. Okay, well that's good. And it sounds like you've taken away a lot of the factors that were causing your mood swings, and that as a result of that it's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to,
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years,
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be
and
good.
And we can make a proper go at reducing these medications. Getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
Then,
All right.
So I'll see you then. Eh?
Yeah. All right. Take care. See you later.
Bye.
All right. Bye now. Bye.
Take a seat for me. Right, I think you spoke to my colleague Dr. Sayer earlier on today, saying you're really low in mood. What's going on?
I don't know, literally for the past couple of days, I can't leave the bed, I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay, is this something you've had before?
I used to have really bad depression, from when I was 17, I got diagnosed with it, but lately it's just coming back. I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
It's literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't. Earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally strip myself in the bathroom because I didn't know what was going on. I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer, because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years.
Yeah.
But right now I'm scared that it's only going to get worse.
Okay, all right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well, look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you, though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those?
Yeah.
Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder, because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? Right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay? Like you did today. If things don't improve, just give me a call.
Perfect. Thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
I'm fine. What
Should be asking that, should I? You should be asking me.
What can I do for you?
I'm actually needs a favour. I've recently swapped into a ground floor flat.
Yeah.
And I've been suffering from depression, and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property, because they've got creaking floorboards. I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night, and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Well, why not?
I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating, because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck, because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying, actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local counsellor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye. So what are the things that you've noticed, Barbara, that make you worried about Sammy?
So there was lots of things which changed. So, for example, you are more energetic than usual. So it seems like your reactions are much stronger than usual. Also, you sleep with service charges, which never happened before.
Sorry, what was that?
Stopped paying service charges, which is very unusual.
Okay, so you have to pay service charges?
Yeah.
But you're not doing it?
No, I'm just behind in arrears. But in a week's time, I'm paying about £100 towards that.
How did that happen, that you got in arrears?
I just slipped behind in payments.
Right, but then you must have spent the money on something else.
Yeah.
So what did you buy?
I just bought shaving, grooming kit.
Must have been a lot of money on that.
Yeah.
Why did you spend so much money on those things?
I don't know how to.
Did you really need them, all of those things?
Yeah, because I groom every day.
Yeah, but you obviously you used to be able to afford to buy what you needed.
Yeah.
And pay the charges.
Yeah.
Were there other things that you bought?
Some shirt, t-shirts, underpants, and cologne.
All right, okay. Bipolar disorder is usually really quite a severe mental health problem in which your mood can either be very high, which is we call either manic or hypomanic, or really very low, depressed. People become hyper. They often buy loads of stuff. Often people will buy things that they can't really afford. They may think that they're famous. I had a patient who bought a ticket on Concorde because he thought he needed to go to the States straight away for no particular reason. I mean, obviously, you've been living at the hostel there for a long time now.
Yeah, 5 years, 4 months. No, today it's 5 years, 4 months.
Is this the first time you've been in arrears?
Yeah, first time, yeah.
So something's not right, is it? Because you wouldn't normally allow that to happen, because you're very responsible.
Yeah.
The worry that I think Barbara has, that you're beginning to show early signs that you might actually be relapsing.
No. Because the thing is, I saw my consultant psychiatrist on Saturday.
Did you?
Dr. Potter. Yeah, I saw him on the street near where I live.
All right.
And he said I look very well.
Right. You can't tell what's going on inside your head from just looking at you, because I would have said you look very well as well.
Yeah.
And the thing is that what we know with the kind of problem that you have, that when people relapse, the first thing that you notice is not that they don't look well. They look fine. And it's just what they're doing isn't quite normal. I think that these are warning signs. If we don't do anything, you will get ill. And we really don't want that to happen again, because you've rebuilt your life. You've been absolutely
well, today
fine.
is 5 years, 4 months
Yeah.
since I was discharged from the hospital.
Yeah. So you've done.
And within myself, I know if I was going to feel ill when I was.
Okay, is that really the case?
Yeah, I know.
That you know? Because most people with your illness don't.
Yeah.
It's very unusual for people with your kind of illness to know. It's always other people who say you're not well, and that you have to then accept that they're right, and that means you should be on treatment.
How do you feel about that, Sammy?
Well, at the moment, I don't think I need any medication. I think I've done well 5 years and 4 months since March 29th, 2010. I was discharged from the hospital.
Yeah.
I motivate myself. I go for walks. My weight is coming down. I don't think I need any medication.
Right. Okay.
I definitely don't think I'm getting ill.
Right.
I feel well within myself.
Okay. Well, our advice is you aren't the normal Sammy that you were a few weeks ago, that you've changed. You aren't as well as you were. You can't notice that. You can't see that. And that's often the case. In Sammy's case, I thought it was really important that he should be on medication now, because it sounded as though he was beginning to relapse, and that could have been disastrous for him, as he might have ended up in hospital, because he wasn't taking any medication for bipolar disorder and hadn't been taking any for quite a long time. We would generally say to somebody like you really ought to be on medication forever. When you get ill, you get seriously ill and you end up going back into hospital. It's such a huge setback if that happens. We think we can avoid it now. All you need to do is to restart treatment. He is the patient, actually, he does get the final say as to whether he takes medication or not. He's taking a chance if he doesn't take it, but then maybe he's entitled to take that chance. Are you willing to see the psychiatrist?
I'm willing to see the psychiatrist.
So we'll do that. We'll do one step at a time.
Yeah.
I do think it's worthwhile going down this route. So what I will do then today is I'll phone them up. I'll try and arrange that you get an urgent appointment to be seen as quickly as possible. I'm sorry, you're obviously upset about that.
Well, I'll see the psychiatrist, talk to him.
Yeah.
He can assess.
Yeah.
He'll assess me, and then he'll tell me if he thinks I'm getting ill or not.
Yeah. Okay.
I think it will be the best thing to do.
Okay.
Right now.
No, you're right. That's that's the right way to do it because they're the experts.
Yeah.
Thank you
All
very
right.
much.
Thank you.
Okay. Bye-bye.
Bye.
Bye-bye.
Very good. Come in, take a seat. Busy day, indeed. Always. William has been in to see me on a number of occasions to discuss his anxiety and his cannabis misuse.
I find that the weed is the only thing that keeps me sane.
When I saw him last, we discussed ways forwards for this to reduce down the cannabis misuse and to try and increase his self-esteem with a long-term view to returning to the workplace.
I really felt bad coming today, not asking not doing what you asked me to do, and I just thought, well, God, if I can't do what the doctors asked me to do, and the job centre are literally might as well be talking to a brick wall.
How are you today?
Yeah, I'm okay. I've been better, but I've been worse. So
okay.
I feel like a better person, like less stressed, like more energy. I'm not thinking about the weed as much. It would be nice if I could cut down and knock it on the head completely to the point where, I don't think about it, but I don't ever envisage it. I don't, not anytime soon.
Okay. And have you what's happening at the moment, any thoughts regarding work?
I mean, I'm still at that, I say crossroads, it's not really a crossroads. I feel like I'm just at that precipice with no real skills that I can translate into the workplace. I mean, I've had some good jobs like many years ago, like another life ago really, and the gap in my CV is just so like huge.
Yeah.
That I don't get the callbacks or anything.
So it's 10 years without work.
It's like 10 years without work. I mean, obviously I've done like a day here, a couple of days here, helped out and done a bit of voluntary work as well, but I feel like I'm going backwards.
How are we going to get things going forwards?
Obviously, I don't want to be on the sick. I don't want to be a benefit, like seen as benefit scum.
At the moment, you're 33 and not worked for 10 years. And
I know, it's shocking.
The chances of returning to work are
dwindling as we speak. I know.
We want you to become productive again, and
I know. I had big dreams. Like this is what my first couple of counsellors was saying. Like, you built yourself up too high.
So
mate.
the only counselling that we would have access to is through WCDAS or IDAS or whatever we're calling them.
It's literally that's my only option from counselling.
From a counselling point of
is
view.
through the drug angle. See, I'd rather talk to a wall than talk to someone condescending with their.
And you've said before.
I mean, what you said before. To me, what's the alternative? Go and have a drink? Like, no thanks.
Yeah,
I'd rather die.
You've said before with the from the cannabis point of view, you use it to kind of treat anxieties and so forth. What if we tried another medication? A medication from an anxiety point of view. Have you been on anything antidepressant, anti-anxiety?
I was on antidepressants for about 3 months, and it was the worst 3 months of my life. Like, you know
which medication that was?
I think it was fluoxetine.
Fluoxetine.
It's like.
What happens if we tried something, perhaps a similar sort of medication called sertraline, and we gave it a try? Should we do that?
Yeah.
Okay.
So I'm open to suggestions because it's literally I've been on this path for like 10, 12 years, bouncing along like just blowing in the wind, literally. And
well, let's have a go because it might help to control the anxiety, and then that may well mean that you're smoking less cannabis. When we start people on these medications, we do like to review them early, so in 2 weeks' time.
Okay.
And so I'll do the sick note for 2 weeks. Okay. And then bring you back. That goes through to the 13th. Brilliant. Okay.
Thank you very much.
I'll see you in a couple of weeks' time.
Thank you.
Okay. Take care.
Have a nice day.
And you.
Hi, Patrick. Come and have a seat. How are you?
Not great.
So it's been a while since I saw you.
I'm really feeling down. I'm feeling
Yeah.
really suicidal. It scares me at the moment.
So I had a letter from A&E from a couple of weeks ago. What happened?
I ended up going to St George's, which I got an initial assessment, and I waited for about 4 hours and basically discharged with 2 leaflets. Nothing.
When anyone ever comes in and tells us about them feeling low or feeling down, it's really important to explore with them exactly how extensive those dark thoughts are. Are they just something that they've had a fleeting thought that would be a lot easier if you weren't alive? Or actually, is it more planned than that? Have they really thought through what they may do, and what steps have they taken to try that? So had you done anything to actually hurt yourself, or was it just the kind of number of thoughts of it?
What happened is I started drinking and I knew that was dangerous, so I stopped drinking when I phoned, and it was the thoughts that where it would lead.
And how much are you drinking at the moment?
I'm sort of drinking every other day, and when I'm drinking it's probably about 6 cans of cider or 2 bottles of wine, that sort of drinking.
So that's kind of crept up quite a bit, hasn't it?
Yeah, from not drinking at all and slowly coming back to it, that's what scares me. If I'm depressed and I'm anxiety, if I put alcohol on top of it, it's dangerous. It's really dangerous. Starting drinking again is a warning sign that, and it distorts everything, and then it brings in the depression and the anxiety, and then I don't know which is which. I don't know if it's alcohol related or am I using alcohol to solve it, but it's dangerous.
It goes hand in hand often, doesn't it?
Yeah.
So the drug and alcohol service, what help are they giving you at the moment, or what contact have you got with them?
I'm going to see them for an assessment. It's a drop-in, and they like you to turn up at least 3 times a week.
And how motivated do you feel about that at the moment?
I really have to do that.
Good.
Because, see, I'm isolated. I'm in my bedsit. I'm feeling sorry for myself. I'm getting depressed. And it's dangerous.
Okay.
Sometimes I just feel like, oh, what's the point? It's just a game. But as you say, there's not a lot you can do right now. It's a slow process.
But it sounds like it's moving in the right direction in terms of the things that you're doing.
Yeah, and the medication I'm not even too sure, but medication doesn't work with alcohol, so...
No. So you're having 150 at the moment, is that right? Yeah. And you're still having it every day, or?
I'm still having it, but alcohol just neutralises it or something. I don't know what it does, but...
Yeah, so alcohol's a depressant, isn't it? So it kind of... switch it. There's no point in having an antidepressant.
When you've got a
if you're going to take a depressant as well. Yeah. So we know that you've got a lot of insight into things, don't you? You kind of know how things go. You've done this merry-go-round.
Yeah, the counselling, it seems to be going okay. It's something I've been looking for over a year.
Yeah.
And I finally got it, and if I finally got it, for Christ's sake, tell her what's going on.
Yeah.
Because I tend to tell people what I wish was going on. I convince people I'm actually okay. This other woman from Once With Mind, she's really helpful. She contacts me about once a week.
Okay, so that's extra support there.
Yeah, and it makes a difference. And
Good.
she's the one encouraging me, do this, and it's like somebody giving you a checklist, and it's so helpful, because you just do it.
Good.
Yeah.
Do as you're told.
Yeah.
All right, it's nice to see you, Patrick.
Okay, so that's everything. Okay.
Later.
And then-
Okay.
Cheers.
Bye.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for
like 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night, and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head, and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two or something, and quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not like regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah.
I do have that hope.
Yeah.
That you are ill, and I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well,
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive. Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
In terms of safety, in terms of those suicidal thoughts, if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we wouldn't want you to do anything when you're not, well.
Yes, sure.
That has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes,
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.